Hi, friends, and welcome back to the Jeffco Connects podcast. My name is Dr. Joanne Fish, and I am here at the Jefferson College JCTV studios. And today I have with me my amazing colleague, Dr. Jan Johnson.
Hi, Joanne, and I am the Associate Dean of Business, Social Sciences, and Public Service.
And today we are so lucky, Jan, because we have these amazing guests with us. I think I'm saying the word amazing a lot, but I'm so excited because our guests today are from Compass Health. Am I saying that correctly? And they're going to talk to us about a new service, relatively new. It's been open a few months in Festus. And I'm going to let them give you the details, but we have Sue Kerfman, and Sue, I'll let you give your title in a second, and Chrissy Herder. I want to say your name correctly as well. So we'll let Sue and Chrissy talk about this great new place and program that has services for our citizens and possibly even some of our students here at Jefferson College. You opened a new facility. Can you talk to us a little bit about the facility?
Sure. Well, so again, Sue Kerfman, I'm the Senior Vice President for Regional Corporate Services, or easier, Jefferson County here. Excited to be here. Thank you for the invite, because again, anytime we can talk about access to care, no wrong door, there are lives saved. Right. So I so appreciate the opportunity. So we had the privilege to really open up a behavioral health crisis center, and they are revolutionary. They are changing access to care. And Chrissy is actually our director for the Behavioral Health Crisis Center, also called the BHCC. So I'm going to let Chrissy start off with talking about our Behavioral Health Crisis Center.
Yes. So thank you so much for having me. So this is our fifth Behavioral Health Crisis Center in our network. So we have one in Kansas City, or outside Kansas City in Raymore, one in Jefferson City, one in Wentzville, one in Rolla, and then this one in Festus we opened up with shortened hours in September and went fully 24/7 in October. And we also have another crisis center opening in Union this spring. Right. So what we are is we're a 24/7 facility. It's a no wrong door facility for anyone experiencing a mental health or substance-induced crisis. So when we say no wrong door, that means anybody who comes to us has come to the right place. We are happy to figure out what's best for you. I mean, maybe we can't meet the need that you have, but we're going to help you get the resources that you need. So anyone can come to us at any time. They don't have to be a Compass Health client. They don't even have to live in Jefferson County. They can be traveling through the state and find themselves in a crisis and come to our crisis center. It can be brought, you can just walk in, you can be brought by police, by EMS. I mean, really, any way you can get to our doors, we're happy to have you. So everyone who comes in is going to be triaged by our nurse, and we have a mental health clinician on staff, and kind of figure out what's going on with them. So when I say no wrong door, I really mean no wrong door. We're never going to tell you you've come to the wrong place, or, don't bring them here kind of thing. So we have sort of two ways we can go with people. So we have what we call our non-unit. So those are for folks who maybe aren't in that, find themselves in that full-blown crisis. So these may be someone who's unhoused, who needs a shower, something to eat. Maybe they need to charge their phone, get warm. We've had people who come in and just, need to charge their phone and have something to eat. So those are kind of those basic needs that need to get met. We can also provide some resources. Sadly, we don't have a magic button for housing, so we have access to the same resources as everyone else. But what we have is we have the time and the phones and someone to kind of assist with accessing those resources. And then we have our unit. So for people who find themselves in a full-blown crisis where they are experiencing extreme mental health symptoms, maybe suicidal thoughts, homicidal thoughts, maybe some psychosis, or they're finding themselves in a substance-induced crisis, maybe they need some withdrawal management, they can go to our unit. So our unit consists of 8 bariatric recliners in kind of like a living room setting, and then we have a 9th one in what we call our quiet room, which is just a little secluded for folks who maybe need less stimulation. So for those folks, we have a psychiatric provider that can provide medications from 10 a.m. to 10 p.m. every day of the week. And the provider is then on call. So if someone comes in at 2 a.m. and they really need to start those withdrawal protocols, or they need some medication, they can still access that if they're on our unit. They can sleep. They can get, a safety plan. We provide really robust safety planning for people who are feeling, urges for suicide or self-harming. We have gun locks. We can help you find places to destroy medications you may have. Maybe pull in those natural supports for you for those safety plans, or maybe just some coping skills. We can provide an intake into services. So if you really are in our catchment area, we can get you set up. So when you leave the BHCC, you'll have appointments for psychiatry, for therapy, or whatever it is that you may need while you're there. So everybody there is going to get a really robust discharge plan. So we're going to make sure that they're able to access resources or whatever they may need so that they don't find themselves in crisis right when they leave our doors. And then we also have follow-up. So we provide 30 to 90 days of limited case management follow-up for everyone who leaves. And the biggest thing I think of what we're doing besides all of that is that we are free of charge. So when you come to us, you're not going to get a bill.
Wow. I heard about this program. The Law Enforcement Academy here is one of my programs, and I was at an advisory board meeting, and someone came and started mentioning it and talking to the other police officers that were in the room. And so then I started perking up, and it seems like police officers can bring someone there instead of taking them to the hospital if that's not the right avenue. What about an individual? How are they going to know to come see you all or to seek your services?
So, there's several ways that people can hear about us. One of the main ways, though, of getting to us is through 988. So if someone were to call 988, find themselves in crisis, they can call 988. 988 can say, hey, seems like you might need a little more services than just something over the phone.
Can I just interrupt?
Yeah.
Explain the difference between like 988 and 911.
Yeah, so 988 is sort of that diversion number. So the 911, if you have a physical medical crisis, right? You need to call 911. You're having a heart attack, you're bleeding, that's 911. Okay. 988 is if you find yourself in that mental health crisis. So I start experiencing very severe depression or anxiety or, any type of crisis. Really, crisis is how we define it. So if you feel that you're in crisis, you can call 988. We also have the 988 diversion. So we've worked with the dispatchers here in Jefferson County. So if someone calls 911 and they're able to assess and make sure they're not in a medical crisis and maybe they're just like having suicidal thoughts or urges, they will then divert that call to 988. So they get a mental health clinician. Okay. Yeah. So either way, you're probably going to end up getting to 988. But so that's the crisis line. And so we have mobile crisis that can come out and get you to the BHCC, or if you call the Behavioral Health Crisis Center, we're going to try to work on that transport for you to get you to us. We know transportation's a big barrier in this county, so we don't want that to be a barrier for people to access services. So we're going to maybe we have somebody who can come pick you up. We can send a mobile crisis clinician out to you. Worst case scenario, we might be able to send an Uber or a cab to come and get you. Depending on what's going on.
So if I come, somebody has had to come get me to bring me, and then I'm ready to leave, how do I get home or to wherever
We're going to take care of that too. So we're going to provide that transportation back home, or say, we have treatment facilities as part of Compass Health Network, and they're not in this area. They're pretty far away for the most part, Warrensburg, Lynn Creek, places like that. And we can provide that transportation too. So whatever your next step is, whether that's a shelter in another area, because we know Jefferson County doesn't have any homeless shelters. So maybe a shelter in another area. Maybe Aunt Sally lives out in Hannibal and she's like, sure, you can come stay with me for a night. We're gonna get you out to Aunt Sally's. We've even worked with coordinated entry and been able to get bus tickets and plane tickets for people to get to family. So we're pretty creative in our problem solving. Yeah. So that's kind of the difference between us and the emergency room, right? We're not just going to be like, well, here's some phone numbers and good luck to you, right? Yeah. We're going to make sure
your doctor next week.
Call these people.
I think what's important to realize, so before the Behavioral Health Crisis Center went in, I was talking a lot with our sheriff here as well as Mercy Jefferson. And on any given night, they would have anywhere from 4 to 8 people in ER or in the jails that had nowhere to go. They were in crisis. Right. They needed mental health resources, but there was no place to go. So kind of in talking both with Eric Ammons, former CEO for Mercy Jeff, now he's the regional president for Mercy, and with Sheriff Marshak, that number was between 4 and 8. That's why we ended up with 8
Mm-hmm.
bariatric chairs for people to
Oh,
come
interesting.
in.
Yeah.
Yeah.
Okay.
So, another thing to think about is if you did not have a behavioral health crisis center and you have a person in crisis, police officer or sheriff picks up that person, they take them to ER, they're going to wait with that person in ER.
Mhm.
And if it's if it's an 8-hour wait, that means that we've taken a police officer off the street for 8 hours.
Wow. I didn't
Yeah.
even think
And
about
if
that.
you have 3 people in crisis, that's 24 hours of law enforcement and first responders.
Right.
And the average drop-off time for a police officer or a sheriff at the Behavioral Health Crisis Center is?
About 7 minutes or less.
Oh,
We usually
my.
average
Oh.
around 5 minutes.
So we can return them back to doing their job.
Right.
That's just amazing. I can't, I mean, Sue, I've heard, you talk about this before, but even this information is new. So where is BHCC in Festus?
At 222 North Mill Street. So we share a lot with the firehouse right there.
Mhm.
And we're the upper level. So if you come in, you see a little ramp, you go up, and we're right up there. We have a doorbell just to kind of control the flow of who's coming in and out. We
Right.
just ring the bell and we'll let you in.
Okay.
And it is 24/7, 365. Never
Yeah.
close.
So
Wow.
I know that there is something about 23 hours. Can you explain that to
Yeah,
us?
so we're considered a 23-hour stabilization center. And so most of the stuff that gets done with folks is going to be within that 23 hours. Now, that 23 hours is not a hard, fast line. If we get up to that 23 hours and there's still some more stabilization needs, we're going to reassess and see if, maybe you need to stay a little longer with us, or maybe you do need a higher level of care, especially with something like withdrawal management. Maybe that's something where they need more of a medical setting. Just because we divert from the hospital doesn't mean that there's not a time and a place for people who need to go to the hospital. Sometimes for medication changes, psychosis, things like that, the hospital stays are appropriate.
Right.
And so we're going to reevaluate at that 23 hours to see if maybe it is something that needs a hospitalization. Our send out rate is extremely low, though. We send out, I think we're below 2% of cases. And most of the people that we send out, honestly, are for medical reasons, because we really aren't a medical facility. We have a nurse, but we don't have medical equipment beyond being able to check vitals. So
Right.
most of our send outs are medical reasons. But there are those times that people do need to go to the hospital. So at that 23 hours, we may say, hey, we're going to keep you another night. Or we may say, we think A, B, or C might be a better option for you. Also for folks who, if someone's unhoused, they've gone through withdrawal management with us, say it's a Saturday and we've got a bed for them on Monday, we're not going to kick them out, and be like, good luck getting to your treatment bed on Monday.
Yeah.
So yeah, they're going to stay with us and we're going to get them that transport to get them to the treatment center.
So very humane and respectful. If I can share an example. So this was maybe a month ago. A professional colleague called me on a Saturday night and said, Sue, tell me more about this behavioral health crisis. I have a child. I don't want to mention the gender. I want
Right.
to de-identify, but I have a child, an adult child who is now in the 20s and has decided they're ready to get clean, like after 15 years. Where do I go? And I said, gosh, the Behavioral Health Crisis Center would be perfect. Gave her the address, and they were secure for the night. And she said, what time do they open? I go, no, they're 24/7.
Yeah.
So
Yeah.
they showed up, were assessed. They started the detox process, and as she was starting to go with withdrawal, and within 24 hours, they actually had for this person an inpatient bed, and this person got into an inpatient bed and is clean for the first time in over 15 years.
That's, again, I'll use the word amazing.
Yeah.
Well, and because I keep thinking about, as you're telling that story, if a person thinks at 9:00 in the morning, gosh, I'm tired of this life, I really want to do something about it, it's Saturday morning, I know places are open till noon. I better make up my mind before noon, but there's a lot of back and forth and self-talk and should I or shouldn't I, or I can hang on till Monday and I'll call my doctor on Monday. So many things happen inside of us when we're trying to make those decisions. And that could be about getting clean. That could be about, if I'm having thoughts of suicide. That could be if I'm in an abusive situation that I'm trying to decide whether or not to get out of. And so many different things that a person goes through, and the mindset of a person who just needs that help. Because I might not wake up in crisis, but by 3:00 in the afternoon, I'm in crisis if I don't make a decision.
You brought up a couple of points. I mean, you can't schedule a crisis.
Right? Exactly.
When I need it, I need it now.
Exactly, yeah.
And I'll tell you, as I've talked with a lot of our community stakeholders and others, are like, Sue, what constitutes a crisis? And I'm like, you know what? What's a crisis for you is not a crisis for me. I think about the one individual who got dropped off, and her person left, and she was here stranded and needed to get back to, I think it was like Oregon.
Oh yeah. Yeah, so I mean, really, it's anything. A crisis can be anything, and so that's where we get really creative. And with my staff, which I think I have an amazing staff. There's just tons of compassion there, and they are going to leave no stone unturned to really figure out, what can we do for you? How can we help you? You need to get back to Oregon? Okay, how are we going to do this?
Yeah.
And
Right, yeah.
and it's pretty amazing what they're able to come up with. And I will say, in Jefferson County, there are a lot of grassroots agencies and churches and programs and things that there's a lot of heart in this county, and it's nice to see. We access a lot of that for folks and work with. We're part of the safety net, and so we're going to work with any agency we can, or to help people get the things that they need, and so we can get people back to Oregon if they need to get back to Oregon. I mean, it's not easy. I'm not going to say come on in, we'll get you a bus ticket, but it's happened for sure.
What made Compass decide to put a facility in Festus?
Well, at the point of our merger, 'cause we used to be Comtree, and as the former CEO of Comtree, I just saw that post-COVID, with the healthcare shortage, wait lists got longer and longer. And I have shared, my daughter is a suicide survivor. And as I saw those wait lists, the burden I carried on my shoulders is, what if someone is not here in the morning because we couldn't get them in?
Right.
And I knew that something had to change, so we started looking for a partner, and Compass was the perfect partner. We're kind of on they provide services in the areas that we're adjacent to, and kind of in talking with the executive team, this would have been a really good area for a crisis center. And I believe what happens is, at the state level, they want to make sure that whether you're urban or rural or a desert, like sometimes we see in the Boot Hill, that there's access to that care. So they want to make sure that there's behavioral health crisis centers throughout the county. So at the state level, 2 areas that had been identified were Union and Festus.
Oh,
So
okay.
it was a beautiful area. It was a great merger, because since they've joined, not only have we gotten the behavioral health crisis center, but we've also gone from 1 to 7 open access locations, and we've added multiple buildings around access to care. And at this point, we have no wait list for primary care or therapy. You can typically get psychiatry within about 2 weeks. And when our Truman building opens up, we will have almost immediate access for dental.
Oh,
Oh,
that's good too. Yeah, because I was going to say,
yeah.
Compass does more than behavioral health, right?
Absolutely.
Yes, yeah.
So kind of, if you've driven down, 61, 67, people may recognize where that old Shop and Save used to be. It was vacant for a very long time, but now there's a beautiful Compass sign, and believe it or not, we are planning our grand opening ribbon cutting, which will be on Friday, May 9th from 3 to 6 p.m. But we'll be finished with construction by probably that first to middle of March. But we're starting to move in furniture.
Oh, nice.
And that will be March 8th through the 14th. People will be transitioning over, and we'll be moving in for care. We may have a soft opening the end of March, but certainly in April. and that's going to be huge. So just about dental, we'll have 19 dental operatories, which is amazing.
Yes.
And we'll also have 2 surgical suites.
Oh, wow.
And we take no insurance, underinsured, Medicaid, some limited commercial plans. So I was talking with, again, one of the hospital administrators, and they were looking for oral surgery for a 15-year-old with impacted wisdom teeth, and there was a year wait
Oh, my.
to get in for oral surgery as a underinsured patient.
Mm-hmm.
Okay.
Well, we can get them right in. Those are who we serve. We serve anyone, but particularly those who are underinsured, no insurance, Medicaid, and again, limited commercial plans.
Wow.
We'll also have primary care, pediatric psychiatry, child psychiatry.
I was just going to ask about,
Well,
yeah.
actually, we have pediatrics. We'll have a wellness center, what we call our psychosocial rehab. There will be substance use treatment. We'll have open access. We'll also have a beautiful event center that will be available for individuals in the community and agencies to utilize. And just to give you a sense of how large this is, our lobby is 9,000 square feet.
Oh, my word.
And there's a playground off to the side for the
Wow.
children inside, because sometimes when parents bring their children, if they're here for dental, they don't have childcare.
Mhm.
There'll
Right.
be a beautiful playground inside that the children can enjoy. And then, yeah, it's very exciting. And we'll have integrated care. So if they're seeing dental and there's a medical, we can get them right in for medical care. If they're in crisis, we can get them with, mental health. It's all in one stop. In fact, if I can just share how neat this is, we had one primary care provider that came in, and he was amazed. He got to tour the building. He said, "This is what you dream about in medical schools, integrated care," because you've done it.
Mm-hmm.
And I
Yeah.
go, yeah.
Yeah.
And he signed on
Oh,
because he
Beautiful.
wanted that
Wonderful.
integrated care.
Yeah.
It's going to be a beautiful facility. And again, while it's in, Festus, we also have many other locations close by.
Well, gosh, we could talk about this all day.
I know,
think.
right. I'm just really amazed with
Yeah.
everything, and,
Yeah.
and it seems like you've thought about everything and with the integrated care and
Mhm.
I wanted to touch on open access and kind of what that means, because I
Yes,
know
please
we
do,
tend to
yes.
throw that out.
Yeah.
It's a same day intake. So basically, people can come into any of our offices. It's 8 to 4.
8 to 4.
8 to 4, and meet with a licensed clinician who's going to do an assessment with them and determine what services they need, and they'll leave with appointments that day. So like Sue was saying, you can have a therapy appointment and a psychiatry appointment within 2 weeks of coming in, getting your assessment done. So it takes a couple hours to plan. If you're going to go in, you don't have to call first. You go in, there's a sort of a welcome packet, and then they'll let you know who you're going to see. It may be someone in person, it may be virtual, depending on the area and who's there. But you can see a clinician, they'll do your full assessment, and you can walk out with your appointments. It's really easy. You don't have to worry about all the follow-up or making appointments first to try to get an appointment and figuring out where to go. You just walk into one of those offices, and
wow.
they'll get you set up. Yeah.
Do you remember years ago, it would take months to see a
Oh,
therapist?
yes.
Now
Oh,
it's same
yeah.
day access.
Yeah.
Yeah.
And no wait lists. And I know, especially for psychiatry, it's very, very hard to find a
Exactly.
psychiatrist.
And it does. It takes
Especially
a
for
while.
kids. I
Mhm.
know with Mercy, they had at one point, I think they were like a 6-month to a year waiting list sometimes. And who can wait that long when you've got a
Well.
child who's, needing services?
Right.
Exactly.
We also
Exactly.
have school-based services. So we now are in many of the school districts. Are we in all the school districts now?
We're pretty much in all the school districts.
Yeah, so we have what we call our community support workers. They are sort of like case management, and we have school-based therapists that work. And so those are for kids who are identified by the school.
And that is so important
Mhm.
because there's so much trauma that those students are dealing with,
Mhm.
and that is just grown, unfortunately, so much. And the teachers themselves need that support,
Mhm.
and even the teachers are experiencing their own trauma. And so to have that kind of support in the schools, that's That's super, super
Yeah,
important.
and especially when you have parents who maybe aren't able to meet that need. Maybe
Right.
maybe they can't take a day off work to go to
Right.
open access, or they, they're unable to, kind of take care of that. They may have their own issues going on, their own mental health
Exactly.
issues, financial issues, all that kind of pressure. And it's nice to know, like, in the school that can be identified and taken care of, and the parents don't have to worry about, oh my gosh, I need to get a day off, or
Yeah.
and they may not be able to
Yeah.
afford
Do
to
you
do
reference
that.
the community support specialist, which we call the CSS, that case manager?
Mm-hmm.
They also work in the schools. They can also meet with that child and the parent in the home setting.
Mm-hmm.
And I know when I was talking with some of the superintendents and the teachers, they're just like, you know what? This has allowed us to get back to our main goal, which is teaching.
Yes.
Right.
Yes.
Because we have this support. We talk about it takes a village to raise a
Mhm.
child. It really does.
It does. You're
And,
right.
whether it be from preschool through college age, we're all part of that connected village of just being a safety net.
So I'll throw this in very quickly because I've done research on trauma in the school settings and how teachers are dealing with that. And you said exactly it. The teachers have been struggling because they have had to learn how to do things like de-escalate situations with students, and they've had to go to their own training on trauma and how to help students, and it takes away from their real jobs, the teaching.
Yes.
Right.
And so because now they have that support here, you're absolutely right, they can get back to what they were trained to do. So yeah,
Yeah.
just amazing. Well, we would love to have you come back sometime and maybe focus on, a couple of the areas that you've talked about. And I know that you mentioned the police and I know for a fact, because I've heard too, Sue and I are members of the same organization, and I've heard them talk about how much help that you've been to
Yeah.
them, and I think that's an important thing to touch on. So
Right.
so we'll need to wrap up for today, but thank you so much for coming.
Oh,
Yes,
thank you. It's
thank
been
you.
wonderful.
And we would just love to have you back sometime, and maybe we can get out to that opening
Yeah,
and do some
I think
filming
that we should.
and
Yeah.
definitely be able to do that. So again, thank you so much for joining us at Jeffco Connects podcast.
And here at the podcast, we are striving not only to empower our students, but also our community, that village that you were talking
Yes.
about. So, and we do that by creating strong relationships and just making those connections. So if you have anything that you want to share with us, please contact us here at Jeffco Connects podcast. Thank you.
Thank you.